Brooklyn Independent Television.
Welcome to HealthBeat Brooklyn on Brooklyn Independent Television. I'm Dr. Monica Sweeney. There may be a few different reasons why you visited the eye doctor recently. Most likely, you needed a new prescription for glasses or contacts. If you're age 50 and over, it could be due to some other change in your vision. But do you know when that change might signify something more serious? A few months ago, I got a much-needed comprehensive eye exam on camera. One of the things my ophthalmologist was looking for is now becoming a major problem affecting adults age 65 and older. Macular degeneration. What exactly is it? And what treatments are available for this crippling condition? HealthBeat Shara Carabin brings us a story of a woman fighting to keep her vision intact.
How are you?
Fine, doctor.
Good to see you. Come on back.
Good seeing you.
Let's take a look.
I woke up one day and I looked out the window of my home, and the building across the street looked like it was bowing, and the windows were all bowing. The corners were buckling.
63-year-old Sheepshead Bay resident Teresa Catalano recalls the day she realized something was very wrong with her vision.
I called and made an emergency appointment, and they said they think that, I was having the problem, and I had to go see a retina specialist.
Have you noticed any changes since I last saw you?
No.
She was diagnosed with age-related macular degeneration, which affects the central portion of the retina known as the macula.
The macula is the part of the retina that's responsible for your straight-ahead vision. And in AMD, what happens is that aging changes begin to accumulate in that area that over time can subsequently lead to a loss of straight-ahead vision.
So, look straight ahead.
Macular degeneration, or AMD, is the leading cause of why people over the age of 50 lose their straight-ahead central vision.
Let's take a look at the left. Again, look straight ahead.
More than 8 million people in the U.S. alone have some form of age-related macular degeneration. There are two types: dry, which is the most common and rarely causes severe vision impairment, and the more serious wet type that Catalano was diagnosed with.
And again, look up. And look down.
The wet type has historically been the type that can cause a very rapid loss of straight-ahead vision over a period of a few weeks to months. The current mainstay treatment for wet macular degeneration is a series of medicines that we inject into the eye that are very effective at suppressing the problem. They don't cure the problem, but they suppress it, and in 95% of patients can stabilize the condition.
Catalano found out about her condition around 10 years ago.
At the time, they didn't have the injections they have now. My right eye will never get the center vision back, but I see peripherally on that eye. It's just center vision is gone. But now that I get treatments with these injections from Dr. Cooney every month, it sort of freezes it at that point.
I'm going to give you a drop. Okay.
So that it'll never get to the point where I won't see, center vision with my left eye. And the right eye hasn't gotten worse.
Good. Keep looking up. Good. Doing great.
Doctors also recommend a well-balanced diet that contains plenty of green leafy vegetables, as well as foods that contain omega-3 fatty acids, such as fish like salmon or tuna, and nuts.
For early AMD or dry AMD, nutritional therapy in the form of a vitamin has been a mainstay treatment that has been proven through National Eye Institute clinical trials. This consists of a combination of antioxidants and zinc. They help slow down the progression.
It's also important to monitor the condition regularly using this Amsler grid and report any changes to your doctor.
As you're staring at the dot, ask yourself, are the lines around it straight, and do they all appear to be present, or is there a segment that is a blank spot? If the answer is everything appears normal, then you switch eyes and do it again to the other eye. And, as you can tell, this is not the type of thing to do every day, maybe once every other day, because you can start to desensitize yourself to this type of test.
While doctors don't know what causes age-related macular degeneration, there are a number of risk factors, including having a family history of the disease, smoking cigarettes, high blood pressure, cardiovascular disease, diet, and excessive sunlight. The most important risk factor is age. In fact, over 30% of those that are 75 years old have the condition. Are there any early warning signs that people should be aware of?
Early macular degeneration and even intermediate macular degeneration, oftentimes people are completely asymptomatic and have no symptoms.
That's why it's so important for people to get screened annually after age 50, because early diagnosis can help limit vision loss in the long run.
Go once at least to see a retina doctor to make sure you don't have it, because mine came and I woke up in one day. The night I went to bed I was fine. The next morning I woke up and all the bricks were waving, and that means that it must have been starting up probably months before.
Yeah, everything went perfectly. So we'll see you in about 4 weeks. Okay?
Yes.
Any problems, you let me know.
Yes, I will.
Okay.
This is Sherry Carabin reporting for HealthBeat Brooklyn.
Watch this and other Brooklyn Independent Television episodes online at brickartsmedia.org/BIT.